Okay, hello everybody. My name is Manu Rekola and I work as a Zinzino independent partner. And today I have a very interesting person here in my interview, Thomas Gundersen from Vitas. Hello, Thomas.
Hello, Manu.
Great that you could take the time and answer to a few questions and give your presentation about Vitas.
Of course, no problem. So should I start then?
Yeah, well, before you start, of course, we partners and maybe customers also get most common questions from the field. And what is Vitas and what you do and how you analyze tests and so on. So I understood that you have a short presentation of your operations and so on. And maybe you could give us that, and if we still have questions afterwards, we can talk about those also. But
yes,
please, the stage is yours.
Oh, thank you. Okay, so my name is Thomas Gundersen. I am CSO and CEO, that is Chief Scientific Officer and CEO of Vitas. Let me see. So shortly about Vitas. So this company is close to 25 years old now. It was established in 1994. So it's a spin-off from the University of Oslo at the medical faculty. And I did my master degree, my PhD, my postdoc, and my research career there for 16 years. And simultaneously, I raised this company, Vitas, together with a couple of professors that you see on this picture here. This is Christian Drevon to the left and Professor Rune Blomhoff to the right. So we are kind of an academic lab, a university lab that's gone commercial, meaning that we have academic services that are high quality, but we have prices that are commercially compete with other commercial companies, and we also have the high throughput capabilities, but still being very advanced. So our customers are pharmaceutical companies, biotech companies, academic institutions, food and nutrient producers, hospital, primary healthcare, and a number of startups in personal nutrition, precision medicine, targeted medicine, and so on throughout Europe. So we have a GMP certification. So this is a quality assurance accreditation that is inspected by FDA in the US, EMA in Europe, and the Norske Legemiddelverket in Norway. So we are located in this building in the Science Park, Oslo Innovation Park. It's in the middle of the university campus in Oslo. So we have the whole entire top floor in this building, about 750 square meters. So here you can see some pictures from our offices on the right, and you can see we have a pretty sophisticated instrumental analytical lab with a lot of equipment. I like to say that we are 45 workers in Vitas, where 18 currently are humans and 28 are robots or machines. So these are our numbers. So we have been running our business for 24 years. We have developed more than 1,500 different analytical methods, similar to the omega-3 fatty acid analysis method. We have applied this in more than 8,000 projects. Every month we receive something like 13,000 samples for analysis. We think we will receive 140,000 samples in 2018, and in total we have analyzed more than 1.7 million samples. So we are a pretty research-intensive company. So we have participated in a number of EU-funded research projects listed here. These are the 7th framework program projects. The first one was Food for Me in 2011, and the last one, Food Ball, which ended this year. So we can see some pretty famous institutions here, like Cambridge in UK. Currently, we are partners in one EU-funded project. This is a Horizon 2020 project called LifeBrain. It's a 10 million euro project running for 5 years, and we are now about 1.5 years into this project. The project is dedicated to the study of the human brain from birth to death, and with the emphasis on dementia, Alzheimer, and depression. And in this project, our task is to develop new methods for biomarker analysis from dry blood spots. So this is a collaboration with 15 European institutions, including Cambridge, Oxford, Max Planck in Berlin, Vitas, and the University of Oslo. So basically, in one slide, what Vitas do is that we do chemical analysis. We kind of count yeah. Any comments, Manu?
No comments. Yeah, just listening.
So we analyze a number of different things. This could be what we call APIs, active pharmaceutical ingredients, like omega-3, vitamin D, or ibuprofen, or any other pharmaceutical active substance. So we investigate the purity, the stability. We do like assay, that's the kind of the concentration of the active. We do characterization of unknowns, impurities, and so in these formulations and raw materials. We also study the uptake, the distribution, metabolism, and excretion of these substances in the body. That could be humans or different types of animals like mice, rats, dogs, and so on. So this is called the bioanalysis, and a kind of subcategory of this bioanalysis is what we call dried blood spot analysis. So dried blood spots is, as most of you know, is blood, usually taken from the fingertip or the heel in children, especially premature children, really small children. And the amount of blood is very small compared to the classical blood sample taken from the arm. So venous blood taken from the arm, typically 5 mils or 10 mils, while from the fingertip on dry blood spots, it's only a drop of blood, typically 50 microliters, and dripped onto a special paper and dried. And this is then sent by mail, regular mail, to the lab for analysis. When we receive this, we do a few sub-samples. We take few punches, what we call it. This is a diameter of 3 millimeter, and extract the molecules for analysis. So this blood can be collected on a different types of devices, some of them shown here. So this is the classical Guthrie card in the lower left corner with 5 circles, each taking about 50 microliters. Then in the middle here, you can see a different type of card with 2 circles. Then you have sticks with paper on the tip. You have more this cake shape type of device where you do not punch, but you actually tear off one of this cake and do the extraction and analysis. And then there is this new device called the Mitra sticks, where you have like a pipette tip with a polymer and not paper on the tip. So these are the standard instructions that we use and that people incorporate into their own instructions. You should most of the time clean your finger with an alcohol swab. You prick your finger with a safety lancet. This works only once and there is no contamination risk. Then mostly you wipe away the first drop. This really do not apply for fatty acid analysis. And then you fill the card. It could be 1 circle, 2 circles, or 5 circles, depending on how many biomarkers is to be analyzed from the sample. Then when the card is fully sampled, you dry it and pack it into the envelope and mail it to the lab. So on the bottom here, you can see what we think is the required quality. So this would be, to the left, a correct sample all the 3 samples to the left will be okay, while the one to the far right is too small for most type of analysis. But actually, this is more than enough for fatty acid analysis. I will get back to that later. So, some pictures from the lab. This is one of the robotic, one of the robotic systems that we use when we receive the samples. So you can see here at the bottom right, you can see the DBS cards stacked into these holders. And there are room for 180 cards at the time. And then there's a robotic system that picks up one card. You can see the blood here. And it takes pictures, as you can see at the upper right corner. And the green color is where the imaging system actually found blood. So this is a smart imaging punching system that can actually locate the blood on the card. So even if it's not in the middle of the circles, it can pick up the blood and do the sampling into these vials, these small glass vials. You can see one punch here now with blood on. And then we add different liquids. We heat, we shake, and we do the chemistry. All happens inside this vial. And you can see now the red color on the paper is not there anymore, so the blood has been extracted, and the lipids, the fatty acids, the omega-3 fatty acids, is now in the upper layer. You can see here there's a different liquid layer on the top here. So then we load these vials into another system. So this is the final analysis. This is what we call a gas chromatographic system. And you can see we have about 140 vials here at the same time with the extracted fatty acid inside. And then we inject a very small volume from this vial, 1 microliter, 1 millionth of a liter, into the system. And the molecules are separated. So this is the output from the system. This is what we call a chromatogram. There are 2 axes, the x-axis and the y-axis. And on this x-axis, it's time. You can see it's 8 minutes here, 10 minutes. And then this is the intensity of the signal. So when we inject this 1 microliter of liquid onto this system, all the molecules, all the fatty acids, they enter at the same time in this end. And then they actually use different times to exit from this system. And these peaks in blue are the different fatty acids. So this is one type of fatty acid. This is another type of fatty acid. And over here, at the end, you can see DHA is this peak. This is DPA, and this is EPA. And this is the arachidonic acid. So a high peak would mean that there's a high concentration of these fatty acids, and a small peak means that it's a low concentration of these fatty acids. So for instance, when we look at the omega-6-3 ratio, being the arachidonic acid against the EPA, you can see that in this case, this is something like 6-7 times higher than this. So the ratio would be 6:1 or less. So this is actually what happens. We measure the height of these peaks, and then we calculate the different concentrations and the indexes. So to secure the quality of the analysis, we have prepared about 1,000 dry blood spot samples from the same blood, meaning that we collect blood, or we buy it at the hospital, from about 20 people. We mix it all together in a large bucket, so it's all the same. And then we prepare thousands of dry blood spots. We put this into single envelopes, we put them in the freezer, and every day we do the analysis from Cincino, we take out a few of these samples. So these samples, they are supposed to be identical. So on the top here, you can see this is the Cincino samples. And in the front, before we do the Cincino samples, we do some quality samples, QC samples. And also at the end, we do the same samples. And then we do the analysis and we plot the results from these QC samples over time. You can see here that we have about 233 samples. And you can see that they are not identical, but very similar, 2.3. So this is the arachidonic acid EPA ratio, omega-6 ratio. And you can see that this is how it's supposed to look. Small differences over time, but no curve going up or going down.
Mm.
In the end here, you can see we have some different behavior. We have 2 instances where we have something a higher deviation than what is usual. So in this case, we need to go to the calculations and see if there is something wrong. And if you don't find anything wrong, we have to do the reanalysis. Then we use the second sample that you provide for us, what we call the B sample. This is like when you have doping analysis, you first do the first analysis. Then to confirm this, you do the second analysis afterwards. And then we can release it. And then if you have normal behavior then in the QC plot, then we can release the results for these samples as well. So this is the quality check. So this slide is related to also to the variation in the analysis. So in this plot, you can see that there is some variation. And the question is, how large is this variation? You can see the average value is something like 2.3, and sometimes it's 2.4 and 2.2. So how large is this variation? So this is basically the same, but these are the numbers for each sample. And at the bottom here, you can see a table, and here you can see that it says CV. So this is the abbreviation for coefficient of variation in percentage. So this is the kind of the scientific way of listing the performance of the method. And you can see these are the different fatty acids. It's 11 fatty acids, C16. This is DHA, DPA, EPA, and arachidonic acid. So it's these four last that's mostly important. And you can see the numbers here. The CVs are spanning from 2.4 to 3.9 percentage. So this is kind of a technical term, and we recently have had an interview with the Finnish television, and this is one of the things they asked. So if someone asks, the precision or the variation in a method is between 2.4 and 3.9% for the different fatty acids.
Mm.
So, as you know, since Ino has done something like 250,000 samples, I think we have done about 225 of these samples, 225,000 samples. So we have quite a lot of data. And that's quite interesting. You can see these are the statistics for 206,000 samples. And this is what we call normal distribution plot. So this is the values for EPA plus DHA for all these samples. And this plot then shows how these values are distributed. So you can see the most common value is here. This is the mean, it's 4.3. So since this is quite symmetric, it means that about 50% of the 200,000 people has a value above 4.3, and about 50% has a value below 4.3. Is that understandable, Manu?
Yes, so far. Even I understand.
And you can see this value 10. Of course, so this is very few people that actually have a value of 10. And for this value, it's very few people that has a value of 11, for instance, right?
Mm.
So this, I didn't say that, but this is the frequency. So it means that it's about 12,500 people that has this value, right?
Yeah.
And another 12,000 this value, and so on. So when you add all this together, it's 206,000. So, so what we call the 95% confidence interval, the range of values where 95% of the population is between 8.4 and 9. This means that it's very unlikely to have a value lower than 1.4 and very unlikely to have a value above 9. Yeah.
Yeah.
So these are the real values. This is the science.
Yeah.
And then the same for the omega-6-3 ratio, the ARA-EPA ratio. You can see it looks somewhat different. It's not symmetric. It's actually very flat on this side. And you can see here that the most typical value would be 9.38. And the confidence interval, the range for 95% of the population is spanning from 1.8 to 26.8. So if you have a value higher than 26, it's very uncommon. And if you have a value close to 1.8, you're among very few. But you can see here, even for the lowest value, it's actually quite a few people that has this value. You can see, because there is not this rounding of the curve on the left side here to the low values.
Yeah.
EPA alone looking like this, going from 0.3 to 4.1. EPA alone, DHA alone. You can see now we have a perfect normal distribution. It's perfectly symmetrical around the middle of 2.8, and the 95% of the population has values spanning from 1 to 5.3 for DHA alone. So when we have done the analysis, we prepare a file looking like this. So these are the IDs. Oh, sorry. These are the IDs here.
Yeah.
The barcode ID. And then we have like a spacing with the different fatty acids here, 11 fatty acids. And in this file, we also have cholesterol, and vitamin D, and HbA1c, which we don't report to Cincino, but to other customers. And then for the different persons then, sending in their DBS cards with the barcode on, we scan the barcode. This is the barcode on one of these cards, and then we add the results for each of these fatty acids defined up here. So this is actually what we deliver to Cincino and to others. And the way we do this is shown here. So what you Cincino guys send us is the DBS card with the ID on. This is the only thing we get. We don't know anything about the person, if it's a male or a woman, if it's been taking omega-3 or not, the age, we don't know anything. You only have the blood and this ID, which is 100% anonymous for us. And that's how it should be also. So when we receive the cards, we do the punching, we read the barcode, we do the analysis, we link the result from the analysis, the 11 fatty acids, to this ID, and then we upload it to the Cincino server. This is what Vitas does. And then this is visualized. So this is not perfectly correct for Cincino, since this is our own server, but pretend that this is the Cincino server. And then the Cincino webpage will then access the data on the server and visualize this for the different customers of Cincino.
That's very clear.
So that's basically it.
Thank you. It was, even I got a lot of information there, and it's very cool to see how the process goes.
Yep.
I think the main questions what we get from the field are of course how the process is done when the sample comes to your lab in Vitas, and how it's handled. And I think you clarified it very well. It's a totally automated process there.
Yep. So I think the last question you had is the capacity.
Yeah. One question has been that, of course, Cincino's goal is to have at 2020 the first million customers, and I think in Finland now, where we work mostly, we have about 70-80% of the customers are in balance oil.
Yeah.
So if we would think that at 2020, when we have million customers, and that ratio would be there, it would be like 700, 800,000 customers. So will your capacity hold that?
Yeah. So I think this is no problem. Do you still see my shared screen now?
Yeah, I do.
Yeah. So just spend a few more minutes on this. So this is kind of the bottleneck in the analysis. This takes about 10 minutes per sample. So to reduce this, we have chosen to use something quite uncommon, and these are like double systems. It's not easy to see, but you can see it on the left picture here. There are like two towers here. So this double system actually doubles the capacity. So it handles 2 samples at a time. And we have like 10 of these now. It's more to the left here on the picture. And it's really like a copy-paste process for us now. If we have another 4,000 samples, we just buy another one and we add it to the left. And it's really, really scalable, this system now, because we've been doing this for 10 years now, and it's so well developed. So it's only like a copy-paste process for us.
Yeah.
So I would say, please send 1 million samples. Yeah, we are prepared. No problem.
Yeah, and 2020, that's the first million. So of course the business doesn't end there, and we have still a lot to do with people globally. What do you think? Because you have been in this business like almost like 25 years or so, 23.
Yeah, 24 years.
What do you think is your strength as a laboratory? You compared like to other kind of labs. Is there a lot of labs actually who are doing this kind of analyzing?
I think we have maybe 4 or 5 major customers that send us DBS samples. Now it's from all Europe. It's from Canada, USA, and I get like maybe 4 or 5 requests every week now to apply our DBS service in different fields. So I think actually we are regarded maybe one of the more advanced and more experienced DBS analytical labs in the world now. And we are getting quite some attention also because of our collaboration with these top-notch institutions in Cambridge and in Oxford and Harvard and Yale and things like that. So we have quite a number of scientific publications coming out each year where we are co-authors with our partners, our customers. So I think the future is quite bright. I think we did a lot of effort on research on DBS analysis a long time before most others. So I think kind of we are really ahead of most people in the world on this. So I think we will see a blooming DBS business in the years to come. Yeah,
I could easily imagine that. So what would you answer if because sometimes we get questions that some person has taken a test, sent it to Vitas, got a results, and didn't use any balance oil or any other omega-3, and then did another test and send it to you, and it was better result. And so what would you answer to that kind of argument then?
I mean, what you eat, there are a lot of omega-3 also in what you eat, right? So if you eat fatty fish like salmon or mackerel or herring or other omega-3 rich products, maybe like very late in the evening, and you take the sample in the morning after, there could be some effect on the results.
Oh, okay.
Yeah. So what the most important thing is really to avoid eating a very omega-3 rich meal the day before you do the sampling.
Yeah. Okay. Yeah.
And also another thing that's important is to not touch the paper. you know, for the type of omega-3 on the DBS paper that Cincino is currently using. I know that this is going to change soon, but it looks something like this, right? You
Yeah.
have this flap.
Yeah.
So if you have like lotion or hand cream, or you have been doing some cooking, butter, or even like cod oil, if you actually got this on your finger.
Yeah.
Cosmetics, and if you touch the paper like this is not good.
Yeah, of course.
Because the fat on your finger will then transfer to the paper, and this will interfere with the analysis.
Yeah, that's logical.
Yeah.
Well, that was very clarifying thing. Hopefully, I can sometime visit your laboratory or.
Yeah, you're very welcome.
Finnish group. It would be great excursion to visit Oslo there.
Yeah, please do. Absolutely.
Yeah, but this was very good. Thank you, Thomas, so much. And if we get additional questions, we can, because we will put this, of course, to our video channels, and I think many partners and customers also in other countries are interested to see it. So I think this will be a very popular video. And if we get more questions, we can of course make another video. But I think this answered to most of the frequent questions.
Yeah.
So thank you very much for that.
You're welcome.
And I hope you the best for this year. And we will do our share to get the million customers and help people to get in balance with the balance soil. That's our mission.
Very good. Thank you.
Thank you, Thomas.
Yeah. Bye then.
Bye-bye.